Welcome to Module 4, Creating Ritual for Healthy Grieving, what is helpful for the grieving mother and her partner, and gender differences in grieving. Creating meaning and creating ritual for healthy grieving. Parents find it meaningful to demonstrate their love in physical ways, including touching, examining, holding, rocking, reading a book, cuddling, and kissing their deceased infant. Parents also find comfort in rituals such as baptisms, blessings, bathing, dressing, and collecting keepsakes. Historically, parents were not encouraged to see their dead infant. The modern standard of care is to offer grieving parents repeated and extended opportunities to have close contact with their baby. There is no published empirical data that justifies insisting that reluctant parents see their baby. However, knowing that they can keep their baby in their room with them for as long as they want, they can hold them for as long as they want, they can even take them home and have a home funeral, is a very comforting and helpful way to transmute the pain and the utter despondent feelings that come up when your baby has died unexpectedly. Just to note, between 50 and 80% of women who have experienced a pregnancy loss will become pregnant again. And the women who get pregnant after a stillbirth or fetal demise are traumatized women. They've had a birth trauma. They are no longer going to have a fear-free pregnancy, and it is fraught with a lot of anxiety and fear and worry. Extra mental health care must be thought of and or addressed before, during, and after a subsequent pregnancy. Individualized care. Ask the parents what they need and any preferences that they would like to have honored or taken into account. And accommodating their needs is a way for them to also feel, again, in control and like they have say over something that they've had no control over. Showing understanding and respect for their beliefs and choices, again, is also incredibly important. And offering the option of a home funeral or memorial in addition to the autopsy and or burial cremation question is incredibly thoughtful. Some parents will know sooner than others about what they need and want, and whether or not they want to see their baby, hold their baby, how much time they're going to need. Do they want privacy? Do they want to keep someone else in the room with them at all times? Do they want their friends and family members to see the baby? There's a lot of questions. They feel incredibly unsure of what to do and how to do it, which is, of course, completely understandable. So as much as there's someone there to help guide them and normalize everything, I think that is the healthiest and best way to help them in the moment. I wanted to share baby Jaja with you. This is a almost 40-week stillbirth that I helped release their baby from the hospital and handed them their baby when they got in their car in the parking garage at the hospital. This couple knew their legal rights and chose to take their deceased baby home with them from the hospital. And as a death midwife, I can help and guide parents who want and choose this option. So I talked to them about how to care for her at home over the next 2 or 3 days. This happened over Christmas, so they waited till the day after Christmas to have the home memorial, and it was just amazingly beautiful and lovely. And as long as a funeral home takes responsibility for the baby's body, the hospital must release the baby to the parents. Many hospitals don't offer this as an option because they don't want the mess or they don't want the added complication of having to keep track of where the baby goes or is. But if you get a funeral home attached to the baby, the hospital then can kind of, be clear and clean with all the paperwork and feel confident that the baby's been handed off to a funeral home to now manage what happens to the baby's body. This was the couple's first child, and I wanted to include her story as an example of as a beautiful way to say a loving goodbye with a home funeral surrounded by friends and family. They chose a minister to officiate, and guests read poems and lit sparklers to give her a magical send-off when the funeral home came to pick up her body in the evening. In addition to doing home funerals for infants and babies and stillborns, I have also facilitated and helped create many memorial services for couples that receive the ashes of their baby. And as another way of saying a loving goodbye with friends and family, that is an option to have your baby cremated and have the ashes then present at the memorial service. And of course, there's burial, and some parents do choose to bury their babies as well. So going back to following the parent's lead, honoring their self-knowledge, recognizing that they are competent in their decision-making process, as difficult as it is, giving them space to make the choices that will satisfy them in the long run or in the moment, certainly. Don't direct or push them into certain decisions. This can cause regrets later. And remind them that they can still exert some control over what happens after their baby has died, thereby alleviating trauma and the accompanying feelings of helplessness. So what is helpful? Again, validating the patient's experience. This is a real baby. Say the baby's name, refer to them as parents, refer to them as the mother or father, offer empathy, normalize their feelings and experience, and talk about the importance of finding and getting good social support. I wanted to take a moment to also talk about incongruent grief, and these are the basic gender differences in grieving. Females typically are more emotive. They want to talk about the baby. They want to talk about what happened. They can show more depressive symptoms, can feel more isolated and irritable. Men tend to be more action-oriented, want to fix it, want their wives or partners to be back to normal. They want their wives or partners to not feel sad or distressed. They tend to not be as emotive or as talkative. And as time goes on, symptoms of irritability can show up in both of them in different ways. And men tend to show more road rage, increased substance abuse, or working longer hours is another one. These are just typically how men and women will grieve and behave differently. I have seen it switch. I have seen men be more emotive and women be more stoic. But generally, this is what you will see as you work with the couple going forward. And educating them on their gender differences is good because it helps normalize their grieving process and that they're not crazy or they're not thinking things are happening when they're not. It really helps them understand each other better. There's something called, in grieving, there's two types of grieving. There's intuitive grieving and instrumental grieving. And intuitive grievers are more emotive and say things like, I feel sad all the time. Instrumental grievers are more talkative in a cognitive, rational way. They tend to go over the details in their heads and think about the deceased and typically say things like, I just can't concentrate or focus. And they express their grieving in doing, in action-oriented type behaviors. Many men avoid grief in one of the following ways. When men experience loss, they often get overlooked. When others fail to acknowledge their loss, men tend to feel isolated, misunderstood, and compelled to keep their grief a secret. We have different social expectations on men versus women, and men are conditioned generally to repress their emotion. And often what lies beneath isn't what is visible on the surface. Men who learn to open up and share their grief will have many benefits to their emotional and physical health, as well as for their relationships and marriage. They will also feel more energy and happiness. Men need to find other men to talk with. A men's support group can be very helpful for this. Counseling can be helpful for those who feel stuck. Couples counseling can be really helpful as well. When the man and the woman do it together. And seeking professional help is a sign of courage and willingness to heal. It's not a sign of weakness. So pointing out that just showing up is showing how incredibly bonded the couple is and what strengths it shows that they show up together and how he clearly wants to live better and find more normalcy again in their relationship. Don'ts of working with bereaved parents. So oftentimes if we go unconscious or we're out in society, We will hear things that just kind of stop us in our tracks. Everything happens for a reason. Let go, move on. Well, at least you know you can get pregnant. These types of things are not helpful. They actually are very hurtful and minimize the loss and often silence people around talking about their losses. Things to try instead would be that offering support, like what would feel helpful to you right now. Empathizing, like, I'm so sorry you have to go through this. It's just not fair. I'm honored to be here to witness your courage and your bravery and your strength. Talking about that you're not alone, that we're here. We're here to support you in any way we can. That is incredibly helpful. This concludes Module 4 on creating ritual for healthy grieving and what is helpful for the grieving mother and her partner and gender differences in grieving. Please continue on to Module 5, where I will discuss secondary and vicarious trauma, countertransference, and professional self-care.